The Thanksgiving turkey was cooked perfectly, the potatoes were creamy, and the tension in the Palmer family dining room was so thick it felt like you could cut it with a knife. I sat quietly at the big table, trying to focus on my food instead of the awkward conversation happening around me. My husband, Thomas, squeezed my hand under the table as if to say he was sorry for his parents' behavior. "So, Thomas says Westside General is offering you a job," my father-in-law, Richard, said loudly from the end of the table. "Smart move, finally considering a real hospital. When do you start?" I took a small sip of water before replying. "I haven't accepted the offer, Richard. I'm happy at the East End clinic." His surprised face would have been funny if it wasn't so rude. "You can't be serious, Margaret," my mother-in-law said, her diamond bracelet clinking against her wine glass. "That place? In that neighborhood?" Thomas spoke up. "Mom, Sarah loves her work at East End. It's important to her. Playing nurse at some small clinic when she could be at Westside?" Richard scoffed. "No offense, Sarah, but real doctors work at prestigious hospitals, make connections, and build a legacy." "I'm building something meaningful," I said softly. "East End helps people who can't afford to pay." Margaret cut me off. "Such a waste of your potential, especially with your education. Wasn't it Harvard Medical, Johns Hopkins?" I corrected her, but I knew it didn't matter. To them, my choice to work at a community clinic instead of chasing money and fame was impossible to understand. "Well," Richard raised his glass, "to Thomas's real achievement, becoming a partner at Palmer Investments at just 32, the youngest partner in the firm's history." I raised my glass with everyone else, genuinely proud of my husband. Thomas worked hard, even if his father's company made the road easier for him. "At least one of you understands ambition," Richard added, making sure to insult me in the process. On the way home, Thomas apologized. "I'm sorry about my parents, you know how they are." I did know. Richard and Margaret Palmer only cared about big names, money, fancy houses, and social status. To them, my job at the East End Clinic was a waste of my medical degree. But what they didn't know, what almost no one knew except Thomas and my closest colleagues, was that I wasn't just a doctor at East End Clinic. I was Dr. Sarah Chin Palmer, the chief of cardiology at Boston Memorial Hospital, one of the best heart hospitals in the country. I split my time between my hospital work and the clinic, which Boston Memorial had created as a community outreach program under my leadership. I had never bothered to correct my in-laws' assumptions about my career. At first, it was because they didn't care enough to ask. Later, it became a matter of principle. I refused to measure success by their shallow standards. Thomas kept telling me to tell them the truth. "They're being ridiculous, Sarah. If they knew you were one of the top cardiologists in the country, then what?" I'd reply. "They'd only care about the Boston Memorial part and ignore the rest. They'll never understand why I spend time at the clinic." So, I let the misunderstanding continue, keeping family conversations focused on Thomas's career and safe topics. It wasn't ideal, but it kept the peace during the few times we saw them each year. I couldn't have predicted how quickly things would change just 3 weeks after that Thanksgiving dinner. The call came at 2:17 a.m. On a Tuesday, I was already at Boston Memorial, having been called in for an emergency heart surgery 2 hours earlier. "Dr. Palmer," said the ER resident, sounding tense, "we have a 64-year-old male with a severe heart attack being rushed in. The ambulance will be here in 4 minutes. Prep the cath lab." I replied quickly, "Have blood work ready and alert the surgical team." "Yes, doctor. One more thing, the patient's name is Richard Palmer. Any relation?" I froze. "He's my father-in-law. I'm on my way down." Everything happened quickly. I called Thomas, who was asleep at home, and then prepared myself mentally. When the ambulance arrived, I was waiting in the ER, my professional focus strong despite the personal connection. Richard was awake but clearly suffering, his face gray with pain. Margaret followed behind him, looking terrified and messy, a huge contrast to her usual perfect appearance. "Richard," she cried, rushing to his side. Then she saw me standing there in my white coat, stethoscope around my neck. She looked confused. "Sarah, what are you doing here?" Before I could answer, the charge nurse spoke. "Mrs. Palmer, Dr. Chin Palmer is our chief of cardiology. Your husband is in excellent hands." Margaret's mouth dropped open, but there was no time to explain. "We need to move quickly," I said calmly but firmly. "Richard, you're having a heart attack. We're taking you to the lab right now to clear the blockage." Richard looked at me, clearly in pain and confused. "You're the doctor, but you work at the clinic." "I'll explain everything later," I assured him as we moved quickly. "Right now, I need you to trust me, he nodded weakly. I told Margaret, Thomas is on his way. The nurse will take you to the waiting area. The next 2 hours were the hardest of my career. Richard's heart attack was severe. The procedure to clear the blockage and place stents was complicated because of his anatomy and how bad the blockage was. I stayed completely focused, putting my emotions aside to do my job. After Richard was stable and moved to recovery, I finally let myself feel everything. Thomas and Margaret were waiting in a consultation room, both standing up as soon as I walked in. He's stable, I said immediately, taking off my surgical cap. We cleared the blockage and placed 2 stents. The next 24 hours are critical, but he responded well to the procedure. Margaret stared at me like she was seeing me for the first time. You're really the chief of cardiology here? I nodded, too tired to sugarcoat anything. Yes, for the past 3 years. I split my time between Boston Memorial and East End Clinic. But why didn't you tell us? She asked, sounding confused and even a little hurt. Thomas stepped in. Mom, you and Dad never asked. You just assumed Sarah was playing nurse because she chose to work at a community clinic part of the week. Margaret looked embarrassed. I don't get it. If you work here, why bother with that clinic? Margaret asked. I sat down, feeling tired after being on my feet for almost 8 hours. Because medicine isn't just about status or money, Margaret. East End Clinic helps people who would be ignored by the healthcare system. We catch heart problems before they become emergencies, like Richard's. We manage long-term illnesses that would otherwise go untreated, and we do it even if people can't pay. But you could focus only on your work here, she said, sounding less sure of herself. The clinic is part of my work here, I explained. Boston Memorial started it as a community project. I helped create the program. Preventing heart disease in poor communities is what I specialize in. I've even written research papers on it. The clinic isn't separate from my career, it's the heart of it. Margaret went quiet, clearly surprised by everything I'd just told her. Thomas put his arm around me, silently supporting me. Richard's recovery was slow but steady. During the 5 days he spent in the hospital, he saw how much respect my colleagues had for me. Doctors asked me for advice, residents wanted my guidance, and even the hospital administrator checked on him, making it clear I wasn't just any doctor. On his 3rd day, while Margaret was at home getting clothes, Richard asked me something unexpected. The clinic, East End, does it really make a difference? I pulled up a chair next to his bed. Yes, it does. Just last month, we found 17 cases of high blood pressure, 3 heart valve problems, and a serious heart defect in a teenager who never had proper care before. Without the clinic, these conditions wouldn't be treated until they became emergencies. Like mine, he said quietly. Yes, your heart attack might have been prevented if you'd had better care sooner. Your past cholesterol and blood pressure readings showed your risk was increasing. He was silent for a moment. I always thought community clinics were less important, not real medicine. A lot of people think that, I replied, checking his phone without saying more. I was wrong, he said, so softly I almost didn't hear him. 2 weeks after Richard left the hospital, the Palmers came to our apartment for a simple dinner. Richard was still recovering and following a strict, heart-healthy diet that Margaret was surprisingly good at preparing. Before we started eating, Richard spoke up. I need to say something. He looked straight at me, his expression more sincere than ever. Sarah, I owe you more than just my life. I owe you an apology. For years, I judged your choices without understanding them. I ignored the life-saving work you do because it didn't fit my idea of success. Margaret nodded and added, we both did. We were so focused on our own ideas of what matters that we didn't see the incredible doctor you are, not just at Boston Memorial, but especially at East End. Thomas squeezed my hand under the table, this time out of happiness instead of comfort. Thank you, I said, that means a lot to me. Richard continued, Margaret and I have been talking about how we can support East End Clinic. I understand from Thomas that you've been trying to raise money to expand the clinic. I looked at Thomas, surprised. He gave me a shy smile. Dad asked how he could help. I mentioned the expansion project you've been working on. Richard nodded. The Palmer Foundation wants to provide a grant to cover the whole expansion, $2 million, with extra money to keep the clinic running. I was speechless. Expanding the clinic had been my dream for years, more exam rooms, a place for imaging tests, and longer hours to help more patients. Richard, Margaret, that's incredibly generous, I finally managed to say. It's the least we can do, Margaret said, and I've been looking over the foundation's donations. We haven't done nearly enough to support healthcare. Richard added with a smile. Also, Seeing the $287,000 hospital bill for my care made me realize how important prevention really is. Later, when Richard and Margaret had gone home, Thomas hugged me. "So, how does it feel to finally be appreciated by my parents?" I laughed. "Surreal. I still can't believe your father went from calling me a nurse to funding a clinic expansion in less than a month." "Nothing like a near-death experience and a giant hospital bill to change someone's mind," Thomas joked. "I didn't want them to find out like this," I said more seriously. "No one should go through what your dad did." Thomas nodded. "I know, but maybe something good will come from it. The expansion will help thousands of people." Sarah. 6 months later, I stood beside Richard and Margaret at the groundbreaking ceremony for the newly named Chin Palmer Cardiovascular Center at East End Clinic. My patients, some of whom had taken off work to be there, watched with pride as I was honored, not just by hospital leaders and politicians, but by my in-laws who had once disapproved of my work. "This center will bring life-saving heart care to our community," I told the crowd. "No one should have to wait until it's too late to get the care they need." After the ceremony, I introduced Richard and Margaret to our staff and patients. One elderly woman held Margaret's hand and said, with tears in her eyes, "Your daughter saved my life last year. I couldn't afford to see a heart doctor anywhere else." Margaret, who once would have felt uncomfortable in this neighborhood, hugged the woman. "She saves a lot of lives," she said proudly, "including my husband's." That evening, Thomas and I walked home. "Are you ever going to tell them you turned down the chief position at Mayo Clinic last year?" Thomas asked. I laughed. "Let's not push it. They're still getting used to the idea that their daughter-in-law, who they thought was just a nurse, is actually helping to change how heart care is given to poor communities." He put his arm around me. "You know what I love most about this whole thing? You didn't do any of it to prove them wrong. You did it because it was the right thing to do." "Though," I admitted with a smile, "the look on your dad's face when he found out I was chief of cardiology was pretty satisfying." "Almost as satisfying as watching him write that $2 million check," Thomas joked. "No," I said seriously, "the best part is knowing the expansion will help thousands of patients. That's worth more than any title or recognition." I glanced back in the direction of the clinic, ready to continue the work that mattered most, making sure everyone could get the care they needed, one heart at a time.